2020 American College of Rheumatology Guidelines for the Management of Gout. They includes the urate lowering medications has to be started. Urate lowering medications has to be started whenever there are tophi or when there is radiographic evidence of gout. Radiographic evidence for gout, or when there are greater than or equal to 2 flares per year. When there are 2 or greater than 2 flares per year with radiographic evidence or presence of tophi is the indication for urate lowering medications. The urate lowering medications to be used are allopurinol. The first choice is allopurinol. Then febuxostat. Allopurinol or febuxostat, they are recommended over probenecid. So first we have to consider allopurinol or febuxostat, then only we have to go for the probenecid. So the first line treatment includes allopurinol or febuxostat. These allopurinol and febuxostat, these are also the first line therapy to treat gout in chronic kidney disease. Patients. Then urate lowering medications. These medications has to lower the uric acid levels to less than 6 milligrams per deciliter. 6 milligrams per deciliter. The target urate levels should be less than 6 milligrams per deciliter. Then for the management of flares, in gout, the proposed treatment is colchicine, NSAIDs, and then glucocorticoids. These are preferred over the interleukin-1 inhibitors, which are the biological medications. So before considering the biological medications, we have to use colchicine, NSAIDs, and glucocorticoids for the management of flares. If gout flares continue, anti-inflammatory medications such as colchicine, non-steroidal NSAIDs, and glucocorticoids should be continued for 3 to 6 months. If the flares continue, the flares persist to occur, then we have to use these medications for about 3 to 6 months. With regular monitoring and dose adjustments. If the target urate level is not reached and the patient continues to have frequent gout flares, then we have to switch over to the pegloticase. That is when there is persistence of flares, when there are frequent gout flares or persistent presence of tophi, we have to switch over to the pegloticase. These are the 2020 ACR American College of Rheumatology guidelines for the management of gout.